Let's discuss the heart, one of the Zhang organs. There are two key points in discussing the heart. First, the physiological functions of the heart, and second, the systemic relationships of the heart. Its physiological functions are as follows: governing blood and vessels and storing spirits. For the systematic relationships of the heart, first, the heart is related to the vessels and the body constituents and shines in the face. The heart opens into the tongue, and the heart corresponds to joy and emotion, and sweat is the fluid of the heart. The heart is located in the chest between the two lobes of lungs, above the diaphragm, which is just like the stamen of lotus. It is surrounded by a protective membrane, the pericardium. The physiological functions of the heart mainly include two aspects: to govern blood circulation and to govern mental activities. The systemic relationship of the heart with the body are as follows. The heart has an exterior-interior relationship with the small intestine and is associated with the vessels in constituent. Reflects its brilliance in the face, is associated with joy and emotion, with tongue in orifice, and with sweat in secretion. Now let's discuss the functions of the heart. First, the heart, their function is governing blood and vessels. The term heart governing blood and vessels was first seen in the Jueyin theory of atrophy. Generally speaking, it means that the heart can push the blood streaming in the vessels naturally, which in turn means that the heart governs the blood of the whole body, and it also governs all the vessels in the body. Blood circulation and its moistening function depend on heart's chi motivation. The vessels all around the body are connected to heart, forming a net in which blood flows. Therefore, heart is named as the house of blood. The heart is linked with the blood vessels to form a closed system. Blood can flow within the vessels fluently throughout the body. The three conditions necessary for normal blood circulations are as follows. The heart chi must be sufficient, the blood must be plentiful, and the vessel must not be obstructed. If there is a disorder in any of the factors, disease will occur. Sufficient heart chi is the most important factor. The function of the heart governing blood and vessels is manifested as pulse, facial complexion, tongue, color, and the feeling in the chest. If heart functions well, the pulse is normal, smooth, and harmonious. Complexion is bright and lustrous, and tongue is red and bright. If insufficiency of heart chi or blood occurs, condition of pulse, facial complexion, and tongue color will be abnormal. For instance, pale complexion, pale and enlarged tongue, fine and weak pulse, and palpitation indicate insufficiency of heart chi. If there is blockage of heart vessels, cyanose face, dark purple tongue with petechiae and ecchymosis, rough or intermittent pulse, and pain in the middle or lateral part of the chest will be manifested. Second function is storing the spirits. The heart storing the spirits is recorded in Suwon, also named as heart controlling the mind. Shen is an important concept in TCM. In a broad sense, spirit refers to manifestations of life activities, such as physical condition, expression, and complexion. In a narrow sense, spirit refers to mental activities, including spirit, consciousness, and thinking. All of spirit activities are controlled by the heart, which is an important function of the heart. The function of heart storing spirits can be manifested as spirit, consciousness, thought, and sleep. When the function of the heart in storing spirit is normal, there will be high spirit, clear consciousness, acute thinking, and deep sleep. And when the function of heart is storing spirit is abnormal, there will be insomnia or dream disturbed sleep, agitation, slow response, insanity from mental disturbance caused by phlegm fire harassing the heart, loss of consciousness, apatheia, amnesia, dementia due to phlegm clouding the heart spirit, or high fever or coma due to fire harassing pericardium. All these abnormalities can be treated according to the heart condition. The two functions of the heart are very closely related to each other. The heart governs blood circulation, and blood is a cardinal basis for substance for viscous functions. Mental activities are external reflections of the functions of viscous. So dysfunction of the heart in governing blood circulation often results in abnormality of the spirits and vice versa. Thank you for your attention.
Let's discuss interviewing the chest pain. Here, chest indicates the front of the chest. A pain in this area is usually due to either the heart or lung channel and always denote a full condition, even though this itself may derive from an underlying empty condition. Chest pain can be differentiated according to its character. A fixed, pricking, stabbing, or needle-like pain indicates blood stasis. Chest pain accompanied by a feeling of distension of the chest itself and the hypochondrium indicates chi stagnation and is usually accompanied by sighing and irritability. An intermittent chronic chest pain that comes and goes also indicates blood stasis, but suggests an underlying empty condition of qi or yang deficiency. A stabbing or pricking chest pain indicates blood stasis affecting the heart channel, especially if it radiates down the left arm. And this often occurs against a background of heart yang deficiency. It falls into the category of chest painful obstruction syndrome. Chest pain accompanied by cough with expectoration of profuse yellow sputum is due to phlegm heat in the lungs and may be seen in acute lung conditions such as bronchitis, pneumonia, or pleuritis. A chest pain in a large area of the chest together with a cough, breathlessness, and a red face indicates lung heat. Chest pain extending to the hypochondrial region may be due to damp heat in the liver and gallbladder channel. Pain in the heart region on the left side of the chest indicates either heart blood stasis or phlegm obstructing the heart channel. Chest pain extending to the upper back is usually due to phlegm or blood stasis. For the treatment, chest pain from heart blood stasis, we use PC6, stomach 40. For the chest pain from phlegm heat in the lungs, we use lung 5, LI11, stomach 40. Chest pain from lung heat, lung 5, LI11. Chest pain from liver chi stagnation, GB34, TB6. Chest pain from damp heat in the liver and gallbladder, GB34, TB6, REN9, spleen 9. For heart blood stasis, stabbing chest pain, phlegm heat in the lungs, chest pain with cough, and profuse yellow sputum. Lung heat, there is chest pain with cough and breathlessness. In liver chi stagnation, there is a distending chest and hypochondrial pain. In blood stasis with underlying empty condition, there is an intermittent chronic chest pain. For the damp heat in the liver and gallbladder, there is chest and hypochondrial pain with feeling of heaviness and sticky taste. Thank you for your attention.
Let's discuss diagnosis according to Qi, phlegm. Phlegm is a very comprehensive concept in Chinese medicine. Phlegm is both an etiological factor and a pathological condition. Phlegm can be difficult to diagnose for novices. This is because phlegm symptoms and signs are often not as tangible as they are in other patents. Phlegm signs can be as varied as they're subtle. Phlegm is often involved in or is directly responsible for many complex and chronic conditions. In Chinese medicine, there are a couple of relevant aphorisms. Phlegm is the root of the 100 disorders, and all the strange symptoms and diseases are caused by phlegm. The signs and symptoms of phlegm can be difficult to recognize in the beginning because they are so subtle and varied. Textbooks that are published in China and those that are inspired by these textbooks tend to describe only a few gross phlegm symptoms and signs, but phlegm is not usually as obvious as this. Phlegm is something you have to train yourself to see. It is often difficult to define precisely where there is a diagnosis of phlegm. It is usually the sum of many small, subtle signs. Phlegm is fluids that have congealed, coagulated, or thickened. Because these body fluids have changed their form of structure, they have none of the nourishing or moistening qualities that Jinye has. They have thus gone from being an aspect of Zheng Qi to becoming a form of Xie Qi. Phlegm can be substantial. It can be seen or insubstantial, or it is not visible to the naked eye. Substantial phlegm can be observed as sputum and mucus in the respiratory passages. Stool or menstrual blood, non-substantial phlegm can be observed or palpated below the surface of the skin as nodules, ganglion cysts, deformations of bones and cartilage, uterine fibroids, lumps and other physical accumulations in the tissues such as gallstones and kidney stones. Non-substantial phlegm can also manifest as a sensation of heaviness in the body and the head, numbness, fatigue, mental confusion, depression, dizziness, nausea, and chest oppression. The pulse can be slippery or wiry. The tongue can be swollen and have a greasy coating. Phlegm is a heavy and sticky yin pathogen. It shares characteristics with dampness, but phlegm is stickier and even more disruptive of the body's qi mechanisms. Because both phlegm and dampness block the Ku-Li, the space between the body tissue and between the cells, just the space in which qi moves. This has important consequences. First, it will result in the blockage of qi, shui, and jinye. This means that there may be signs of stagnation of these substances in general and of the various qi, ji around the body. This could be symptoms and signs such as nausea, loss of appetite, and a heaviness in the chest, as if there is a large stone on top of the chest. Phlegm's blockage of qi in the upper jiao can also result in palpitations and shortness of breath. The stagnation of qi can cause the person to feel fatigued and lack energy. The feeling of fatigue will be worse in the morning because the lack of movement of qi during the night will increase the stagnation of phlegm. They will often feel very tired in the morning and can have difficulty waking up. The fatigue and heaviness can also result in an increased need for sleep. The problem is that the person will often find that the more they sleep, the more tired and heavy they feel. This is because phlegm will stagnate even more whilst they are lying down. As well as fatigue, they may feel that they are a bit fuzzy and heavy-headed and are not fully present mentally. This will be especially apparent in the mornings when they will often be slightly absent and go around in a bubble. They may also lack appetite in the morning, and if they have a cough, it will also be worse in the mornings. Once they get going and are physically active, the signs and symptoms will improve. Phlegm can also manifest with areas of skin that are numb because phlegm will block shui and thereby shen, so that it does not circulate in an area. This is also why phlegm can result in numbness elsewhere in the body. As well as stagnation, the body can be characterized by heaviness. This will also be seen on the mental and emotional level because phlegm will block the heart's orifices. This means that the shen is restricted in its movement, which is why phlegm can often be a contributing factor when a person suffers from depression. When phlegm is very pronounced, it can be seen in the person's eyes. There can be a tendency to have blobs of sleep in the eyes and the eyes can seem glazed. The shen in their eyes is not bright and lucid. It can be difficult to make clear eye contact. They may look into space whilst they are talking to you, which is not because they are shy and have difficulty looking you directly in the eye, as is the case where there is heart and gallbladder qi shu, or because their gaze is restless and shifting, as it is when there is heart fire or phlegm fire. Rather, it is because their shen is smothered and blocked and they are in a bubble of their own. Their vision does not come out of their head. These eyes and gaze can be observed when someone has drunk excessive alcohol or taken narcotics. They may also have the feeling that they are in a bell jar. It's a feeling most people will have experienced when they have a heavy cold. Because shen is blocked, the person may seem confused and unclear in their thinking. They may have difficulty finding words. If the blockage is severe, they will have incoherent speech or will think one thing but say something else. In extreme cases, for example, in some mental illnesses, a person can sit and talk to themselves or to a person who is not there. Thank you for your attention.
Diagnosis according to 6 stages. The Jueyin stage. This is the deepest level that pathogenic qi can reach. It is very critical when pathogenic qi has reached this stage. There is an extreme Cheng qi deficiency, and the regulation of yin and yang has become chaotic. At this point, yin and yang can start to separate. This will often manifest with symptoms of extreme heat or cold, or a violent alternation between the two. There will often be a symptom of heat and cold simultaneously. The heat can, for example, manifest in the upper part of the body and the cold in the lower part. There may be extreme heat symptoms in the torso, but extreme cold symptoms in the extremities. The heat will injure the fluids. There can be a strong thirst, and the person's skin and flesh can be wizened. Ascending yang will manifest with a sensation of heat, turmoil, and pain in the chest. The presence of heat and cold simultaneously can manifest with a gnawing hunger, but no desire to eat. There may be vomiting and diarrhea. A more harmless variant of this pattern is observed when there are intestinal worms. Exogenous pathogenic qi that has penetrated into the body's deepest level and fundamentally damaged in our young. Ingestion of contaminated food. Symptoms and signs: restlessness and turmoil in the chest, extreme thirst, pain and burning sensation in the cardiac region, hunger with no desire to eat, cold limbs, diarrhea, vomiting of worms, wiry pulse. Key symptoms: restlessness and heat in the cardiac region, cold limbs, hunger with no desire to eat, persistent thirst. Treatment principle: drain heat from above and cold from below, harmonize yin and yang. We can choose from the following acupuncture points: stomach 36, REN 12, liver 3, P6, and 220. We tonify stomach 36 and REN 12, even technique on liver 3 and pericardium 6, and drain 220. Liver 3 harmonizes liver channel, pericardium 6 harmonizes pericardium, stomach 36 and REN 12 harmonizes stomach, 220 lowers rebellious yang qi. Relevant advice: this will depend on how much heat and cold is present. It is important that the patient gets adequate rest and does not overexert themselves. If there are worms, the person should take medication that kills the worms and avoid further contact with sources of infection. The Jueyin pattern can be caused by Taiyin stage and Shaoyin stage, and it can result in Taiyin stage and Shaoyin stage as well. Thank you for listening.
Channel problems, use of distal points. Acute cases. In acute cases, the distal point is used first on its own with a reducing method in order to clear the obstruction of the pathogenic factors and open the channel to make it ready for the use of the local points. A few examples will clarify this technique. In acute sprain of the lower back in the midline, just above the sacrum, one can reduce Du-26, Renzong, first while the patient gently bends forwards and backwards. This helps to clear the obstruction in the channel. After the manipulation of the distal point, the patient lies down and local points are used according to tenderness. These may also be cupped after insertion of the needle. Incidentally, the use of DO-26 as a distal point is an example of a distal point located on the head rather than on the limbs below the elbows and knees. In acute sprain of the shoulder joint affecting the large intestine channel, one can strongly reduce stomach 38. While the patient gently moves and rotates the arm, perhaps with the help of a third person if possible. After manipulation of the distal point, local points are used according to tenderness and according to the channel involved. If the affected channel is a small intestine, bladder 58, in acute sprain of the neck with pronounced rigidity, one can use the point GB39 with reducing method while the patient moves the head from side to side gently. After withdrawing GB39, local points in the neck are needled. The arm-leg correspondence of paired channel with the same polarity and potential is used in the treatment of acute sprain of the joints. This is based on the principle of correspondence between shoulder and hip, elbow and knee, wrist and ankle, and on the relationship of leg and arm channels of the same polarity. That is, lung, spleen, heart, kidney, pericardium, liver, large intestine, stomach, triple burner, gallbladder, and small intestine, bladder. In acute sprain of a joint, one should first all identify the channel involved and then choose as a distal point a point on the related paired channel of the same polarity and potential on the other limb, and often on the opposite side. Some examples will clarify this. In acute sprain of the wrist, one would use a distal point on the feet, choosing the channel on the foot related to the involved channel of the wrist. For example, supposing the main tenderness is on the point TB4, one can choose the leg channel related to the triple burner channel with an upper-lower relation. Example, the gallbladder channel. On the gallbladder channel, one would choose the point with a corresponding location to the wrist point. Example, on the ankle joint. This would be GB40. Supposing the main tender point is lung 7. The point used on the foot would have been spleen 5, based on the correspondence between wrist and ankle. If the sprain had been on the elbow and the main tenderness on LI11, the point of the foot chosen would have been stomach 36. If the tenderness is on LI15 in the shoulder, the point on the leg chosen would be stomach 31. Based on the correspondence between shoulder and hip. This illustrates in figure 70.12 the correspondence among points of the bright yang channels according to this theory as an example. As mentioned above, according to this method, these distal points are often used on the opposite side, bearing in mind the above correspondences between joints and the related leg and arm channels. We can make a table of related distal points to use for each joint according to the two above correspondences. As the table notes, correspondence of points to joints of the upper and lower parts of the body. The joints would be on the shoulder. So large intestine on the arm would be LI15, on the leg, stomach 31. Joint would be the triple burner. On the triple burner on the shoulder would be triple burner 14 and GB30 on the leg. For the small intestine would be SI10 and on the leg, bladder 36. Again, on the elbow, LI11 on the arm and stomach 36 on the leg. On triple burner, it would be triple burner 10 and GB34 on the leg. SI8 on the arm and bladder 40 on the leg. For the wrist, it would be LI5 on the arm and stomach 41 on the leg. Triple burner 4 on the arm, GB40 on the leg. SI5 on the arm and bladder 60 on the leg. On chronic cases, the combination of distal and local points in chronic channel problems is also nearly always used, and in this case, local and distal points reinforce each other's actions on the channel. The main distal and local points are the same as those indicated above. Thank you for your attention.
Let's discuss yeast stagnation or blood stagnation in the stomach as we continue with diagnosis according to Zhang's two-organ patterns. Yeast stagnation in the stomach is always a chronic pattern that will have arisen from other stomach imbalances. The etiology will depend on which pattern of imbalance are involved in the generation of blood stagnation. Its symptoms and signs are as follows: sharp, stabbing, piercing gastric pain, pain that is worse on palpation, pain that is aggravated by eating, vomiting of dark blood that looks like coffee grounds, dark blood in the stool, nausea, the middle of the tongue or the entire tongue can be purple, the sublingual veins may be swollen and purple, choppy or wiry pulse, especially in the right gone position. The key symptoms here are stabbing and piercing gastric pain, vomiting of dark blood, purple color in the middle of the tongue. For the treatment principle, we invigorate blood, dissolve blood stagnation in the stomach, and regulate stomach chi. For the acupuncture points, we can choose from stomach 21, stomach 34, stomach 36, pericardium 6, REN 10, REN 12, REN 13, spleen 4, spleen 10, UB 17, and UB 21. We all needle with draining technique. So stomach 21, stomach 36, REN 10, REN 12, REN 13, and UB 21 regulates stomach chi and invigorate blood in the stomach. Stomach 34 invigorates blood in the stomach and stops pain. UB 17 and spleen 10 invigorates blood. Spleen 4 and pericardium 6 together open the chongmai and invigorate blood and regulate stomach chi. As for the relevant advice, this will depend on which imbalances underlie the blood stagnation in the stomach. Blood stagnation in the stomach can be caused by the following patterns of imbalance: stomach chi stagnation, stomach fire, phlegm fire, liver chi invading the stomach, invasions of cold in the stomach chi deficiency, and stomach chi deficiency. In turn, this can result to stomach chi stagnation and food stagnation. To recap, blood stasis or blood stagnation in the stomach has its etiology in an overconsumption of hot food, smoking, overeating, or eating too quickly, emotional strain, as in prolonged anger, frustration, and resentment, and overwork. The underlying pathology, if there is stomach fire, retention of food in the stomach, liver chi invading the stomach. The symptoms and signs are severe stabbing epigastric pain, which is worse at night and worse for pressure, nausea and vomiting blood and blood in the stools. The pulse is wiry and the tongue is purple. The treatment principle: clear stasis, nourish blood, stimulate the descending of chi. In acupuncture treatment, we can choose the following points: stomach 36 to harmonize the stomach 19 to harmonize the middle burner, spleen 4 to open the chongmai, GB 34, of course, is the liver chi, bladder 17 clears stasis and quickens blood, REN 11 harmonizes the middle burner and regulates chi, stomach 21 transforms stagnation, Sanjiao 6 clears heat in the three burners, pericardium 6 with spleen 4 opens the chongmai, REN 12 harmonizes the stomach, spleen 10 clears stasis and quickens blood. We needle these points with drainage. Thank you for your attention.
Let's discuss diagnosis according to Qi, Shui, Jinye imbalances, Qi stagnation. When there is Qi stagnation, Qi is not flowing as it should. There can be a local stagnation of Qi in a specific place in the body, or the stagnation of Qi can be general and systemic. A local stagnation of chi can manifest as tension and spasmodic or fluctuating pain that is not completely fixed in its location. There can be a feeling of distension or bloating in the area. When there is chi stagnation, the feeling of distension or bloating is more dominant than the pain itself. However, this does not mean that the pain experienced when there is chi stagnation cannot be very intense. There can be a physical swelling in the area, but it can also simply be subjective sensation of bloating and distension. A generalized chi stagnation will often cause symptoms such as abdominal bloating, irritability, mental depression, and mood swings. There can often be a need to yawn or sigh. This is the body attempting to disperse the stagnant chi. By yawning or sighing, the body draws an extra air or that chi and thereby can create more song chi, which can move and disperse the stagnant chi. Belching or breaking wind can relieve chi stagnation in the digestive system. An important symptom seen in chi stagnation is fatigue. Even though there is a reality enough chi in the body, fatigue is experienced because the chi is stagnated. It will be experienced as fatigue and lack of energy and also a lack of motivation and laziness. When there is chi stagnation, the fatigue will usually be worse in the morning and after the person has been sitting still for a long while, because the lack of physical movement will also cause chi to stagnate. This type of tiredness should not be confused with chi deficient fatigue. Chi deficient fatigue gets worse during the day as chi is consumed. Chi stagnation fatigue is often worse during periods when the person is under emotional strain or faced with situations that they are dissatisfied with. Not only can a person with chi stagnation have difficulty getting going in the morning due to feeling tired, they can also be more irritable in the morning until the chi starts flowing more harmoniously. Chi deficiency may be a contributing factor in chi stagnation. In the same way that water is a stream can stop flowing if the water level becomes too low, chi can stagnate in the channel system when there is too little chi. The symptoms and signs seen in chi stagnation are characterized by whether there is a localized stagnation of chi in the channel system, for example, elbow pain, or when the chi stagnation is on the sangfu level. When the chi stagnation is on the sangfu level, the symptoms are characterized by signs that organs are not carrying out their function optimally. When there is a general state of chi stagnation, the liver will usually be involved. This is because one of the primary functions of the liver is to ensure the free and unhindered movement of chi in the whole body. Stagnant liver chi can also invade other organs, especially the stomach, spleen, lung, and intestines. This invasion of liver chi will disrupt the functioning of these organs. One must, however, be careful not to diagnose all chi stagnation as liver chi stagnation. The chi of other organs can also be stagnated without the liver being involved. Etiology. Chi stagnation can arise when there is an emotional turmoil, frustrations, unresolved emotion, repressed anger, and irritation or stress. It can also arise from a lack of physical activity. Many other patterns of imbalance can directly lead to chi stagnation, such as food stagnation, cold, dampness, phlegm, and so on. Localized chi stagnation will usually be due to a physical trauma, and when blood chi blocks the movement of chi in the pathogenic chi blocks the movement of chi in the channel system. Symptoms and signs: bloating and distension, distending spasmodic or throbbing pain, which can come and go. Pain that is not localized to a particular spot. Physical or subjective sensation of swelling in the area, irritability, mood swings, depression, a need to yawn or sigh, symptoms that are relieved by belching, passing wind, or yawning, fatigue, especially in the morning and when physically inactive. The sides of the tongue may be swollen, and there is a wiry pulse. The key symptoms, there is distension, swelling, wiry pulse. For the treatment, we need to spread the chi, and the acupuncture points we choose from LI4, liver 3, liver 14, GB34, Sanjiao 6, UB18, Ren 6, Ren 17, and local points. Needle technique is draining. For the explanation, the combination of LI4 and liver 3 spreads stagnant chi and blood in the whole body. Liver 14, GB34, and UB18 spread liver chi. Sanjiao 6 circulates chi in all three jiao. Ren 6 circulates chi in the middle and lower jiao. Ren 17 circulates chi in the upper jiao. Relevant advice: when there is stagnant chi, it is important that the person gets enough physical activity. Exercise and the dynamic exercise will help the body to move the stagnant chi physically. Massage and stretching will also be beneficial. If there are emotional issues beneath the imbalance, whenever possible, the person must try to resolve this. If it is not possible to resolve these issues, reaching a position of acceptance is important. Chi stagnation can be caused by the following pattern of imbalance: liver chi stagnation, chi deficiency, blood stagnation, dump, phlegm, accumulation of fluid. Chi stagnation can also result in the following pattern of imbalance: blood stagnation, heat, and phlegm. Thank you for your attention.
Thank you. Okay, now let's talk about depression. Case history 1. A 43-year-old woman had been suffering from depression for several years. This was very apparent as soon as she started talking. She looked very distressed and in mental anguish and frequently burst into tears. She had suffered from the breakup of a relationship and she felt very depressed. She also felt confused about her life aims both in her work and in relationships. It was very obvious that she had very low self-esteem and harbored suicidal thoughts. During the first interview, she mentioned only her depression and the shock following the breakup of her relationship. A week after the first interview, I got an email from her. In it, she described how she was sexually abused when she was 10 years old for 9 months by her teacher. To keep her quiet, he told her that she was evil, that she had made him do that to her, and she would never amount to anything except a prostitute or similar. He also told her that she was stupid. He coerced her not to say anything, threatening that if she did, people would know what she was, that is, an evil, twisted, stupid slut who deserved to be abused. On her 16th birthday, she was still a virgin and wanted to remain so. She was raped by her boyfriend. She had been struggling with this for the past 32 years. She went to university to prove to herself that she was not stupid, but she said that she was still now struggling with feeling unworthy. She put herself down all the time and blamed herself constantly. Her boyfriend of 11 years left her for a younger woman, telling her that there was no one else and that it was all her fault. 4.5 years later, she was still trying to come to terms with this. Her boyfriend's words took her right back to the abuse. It was as if he triggered the same feelings of shame as she had felt when she was abused. She said that it also made her feel like a child, totally unable to cope. Then having been made redundant 18 months previous to this consultation made her feel really useless and unwanted. Her letter was very eloquent and bared the roots of her emotional problems very clearly. Her eyes had an anguished look about them, looking like a cry for help. Her periods were regular, but she bled for 9 days and suffered from her premenstrual tension from soon after ovulation. Her tongue was red, redder on the sides with a sticky yellow coating, and her pulse was wiry all over in every position. The diagnosis, obviously, was a sexual abuse suffered when she was 10, wounded her emotionally in a very deep way. It caused her to have deep feelings of worthlessness and shame, and the cruel behavior of her boyfriend resonated with those feelings from the age of 10 and triggered her depression. Emotional stress had caused chi stagnation. This is evidenced by the tongue and pulse, both of which play a very important role in the diagnosis. Judging from the tongue and pulse, this patient was indicating a full condition. The redder color of the sides of the tongue, the wiry pulse, and the premenstrual tension indicated liver qi stagnation as the main pathology. However, the redness of the tongue clearly indicates the stagnant qi has given rise to heat. As for the emotional etiology, I feel that it would be wrong to attribute it to anger simply because there's liver qi stagnation. I personally feel that the liver is affected by other emotions too. In her case, shame, frustration, and feeling of worthlessness. The stagnation of liver qi restrains the coming and going of the ethereal soul, and this results in her depression and confusion about her life's aims. Thank you for listening.